Okay, everyone, good afternoon, and you're very, very welcome. This is number 6 in our series of webinars on Recondition the Nation. It's absolutely delightful to have you all here, sort of sharing experience and best practice and hopes for reconditioning. So the Recondition the Nation, for anybody that isn't aware, came off the back of the deconditioning games and the successes that had in both terms of patient and staff well-being. And the aim, I suppose, is to reduce harm and to increase well-being. We've noticed some great results, and in this campaign, the Recondition the Nation, we've actually already given out over 700 medals and 2 platinum awards. So it's going really well, and as I said, this is number 6 in the series, and I am quite sure we are going to be inspired and motivated today by the speakers that we have. So I'm joined on the call today by Helen Bennett, who's the Head of Improvement for the Midlands, London and East of England, who is going to introduce Professor Charlotte McArdle, who'll share with us, and then we'll have time for questions. And later in the webinar, we'll speak to colleagues at James Paget. You're very welcome, ladies. So Helen.
Hi, thanks, Emma, and a really warm welcome to all of you. Just really recognising that we're just about to go into a bank holiday weekend and all the pressures that faces, so we do really appreciate you joining us. This session is recorded, so you will be able to share with your colleagues post the event, so that those that aren't able to join. But really delighted to welcome back Charlotte McArdle, who, as some of you, if not all of you, will know and recognise really well. We're really happy that you're able to join us today in your role as Deputy Chief Nursing Officer for England, and knowing that just a little bit about Charlotte is that she leads on improvement, safety, sustainability and innovation as part of Team Chief Nursing Officer. And we've been really lucky over the last year to work a little bit more closely with the team and with Charlotte and her team, and specifically around some of the discharge areas and understanding patient-facing nursing teams out in the discharge forums and how things are looking from their perspective. So delighted that you can come and share with us your thoughts and experiences, and share with us your views on what deconditioning and reconditioning means, and where your thoughts are on that, Charlotte. So I'll hand over to you, and really happy to hear from you as our keynote speaker today. Thank you.
Thank you, Helen, and thanks everyone. It's great to be with you today, and appreciate that it is just before the bank holiday weekend and many people are trying to get wrapped up for leave. So, and also apologise in advance because I am carrying a head cold, viral stroke cough thing going on. So if I have to stop, just give me a minute, and I'll try to get through the presentation. So I am going to share my screen. It'll just take a wee sec to come on. For the purposes of today, what I thought I would probably focus on is a bit more about the leadership capacity and some of the underpinning, I suppose, practice ideas that we have around how we get to a place of wanting to drive forward such an important and innovative programme. And, you know, when we look at the success that many organisations have had, and the number of medals and awards that have been given out for good practice and getting this off the ground, engaging patients in exercise in a really innovative way, I think it's important to think about the key tenets of that and what's driving our behaviour and where we need to go with this. So I've entitled this Passion in Practice, and I wanted to start with a look at last Friday. Okay, I've lost my screen. Can you see the screen still? Slides? No? Did they come up at all?
Yeah, they came up, Charlotte, and they've popped down again.
Sorry, don't know what happened. One sec.
Perfect.
You got them now? Okay. So I'm just waiting on mine to load. There we go. So yeah, so last Friday we had a workshop as part of the new strategy for the CNO, our professional strategy, and one of the key things is around person-centred practice. So we had a whole day, a workshop with the group, identifying what our values and beliefs were and what our ambition is for the strategy, and then what we'd want to see that as part of the actions that go forward in the nursing strategy. So I thought it would probably be a good place to start with the person-centered practice framework, which I have sort of lived and worked by for most of my nursing career, but now the framework actually has been developed into a multidisciplinary approach, and it's available in another edition and a different colour than the blue and purple. So, but for me, it's about humanistic care, and it's about therapeutic relationships with our teams and our patients, and treating people as individuals with respect, building mutual understanding for them, and I suppose reflecting on the standard of care that I know we all aspire to in our practice, regardless of our professional backgrounds. But I think the challenge for us is about how we do this and how we build this into our daily practice, and how we enable nursing and the multidisciplinary teams to deliver the type of care that I know you want to. And the framework has 4 domains, really, and it works from the outside in. So it's about the prerequisites, the focus on the attributes of staff. So, their competence and skills, their professional judgment, their commitment to the job, etc. And then they're the key building blocks in order to work as a healthcare practitioner, I suppose. And then the practice framework itself reflects on what I describe as the messy world of practice, because no 2 days are the same. Every day has its unique challenges and complexities to be dealt with. And I think that kind of care environment that we're talking about can often hinder us or help us to deliver the type of care and the quality of care that's required in order to do something like the deconditioning or the reconditioning games. The person-centered processes focus on ways of engaging then, and the ways of engaging are really, as we would understand it, about being individual, by sharing decision making, being present, being sympathetically present, being there for the patient, understanding what's important to them, really, and taking that positive shared decision making approach with them, which gets you to the center of the flower, if you like, which is around the person-centered outcomes. So just taking that one step forward. If we look at the care context, the environment in which we're all delivering care at the moment, there are 2 things that stand out for me in thinking about passion and practice. So compassionate leadership for me is about looking after ourselves, our colleagues, and also the people that we care for. And compassionate leaders are problem solvers. They are innovators. They're people that make sense of the challenges that they face, and often find, and nurses are particularly good at this, finding workarounds. So we find ways to get around problems on a day-to-day basis for the benefit of our patients. And I think that's the kind of space that we're in with this type of innovation that we have. So we're finding ways to support patients to get up, to get dressed, to exercise, to mobilise, to use their muscles, to help their independence and effectively get a better outcome. So by being present and engaging with people, understanding from the person's perspective, be that the patient or their family or the staff, what's really important to them. And in going back to the framework itself, this, I think, increases self-efficacy and self-awareness in the team. And I suppose that then creates the can-do attitude, for which is really important, where we feel often sometimes disempowered. And I think that disempowerment is something that's been expressed to me in the work that I've done with Helen and others over the last year, but also on the back of the pandemic and people feeling very tired and exhausted. So I think that we have to create a different narrative for them, to engage them in a fiery conversation about the passion, about why they came into healthcare in the first place, and then to create these innovative solutions. So I think when we look at the organisations that are succeeding, these are some of the qualities that we see. Then the IHI framework focuses on what's important to staff. So I personally believe that you can't look after patients all of the time without looking after the staff, because they can't never give their best to patients. So asking them about what's important to them and igniting that language of passion to create a movement towards delivering person-centered care. If we look then at the work that was done in the Courage of Compassion from the King's Fund, where it talked really about the impact that COVID-19 essentially had on nursing in this particular case, but I think the same is applicable right across the multidisciplinary team. and they talked about how nurses were feeling disempowered, disenfranchised, not in control of their work. But I think it takes courage and tenacity and steadfastness to do this type of work, and to really provide autonomy so that staff need, so that they do feel in control of their working lives and that they are able to act consistently with their values and beliefs. The reason we all came into healthcare in the first place, to make that difference. They need to find a sense of belonging and a connection to both the people they care for, but also the team around them, and feeling part of that team and feeling valued and respected. And the final thing that came out of this report, which I might have said was on behalf of the King's Fund, but Mike West, who wrote the Compassionate Leadership book, was a key author in this, was the contribution, the experience that they need to be effective. They need to know that the work they're doing is valued and making a contribution to the overall outcome. And I can't really think of any better, I suppose, set of circumstances where engaging in this work in your organisation kind of gives that passion, ignites that spark, and you feel valued and that you're making a real contribution. But as I said at the start, I think it does require courage and bravery and compassion. And I think that often we're braver than we think we are, or than we believe. We're stronger than we seem, and smarter than we think. And I think, you know, Winnie the Pooh is a very simple quote, but actually it says an awful lot about the skills and strength that we need to work in the healthcare environment. So moving along then to thinking about how do we do this? IHI have the improvement framework, as I said, around joy at work. And Don Berwick, many of you will be familiar with Don Berwick, who is the president of the Institute of Healthcare Improvement for many years, and has done quite a bit of work both in the UK in supporting transformation and improvement, and nationally and globally. So he has a call to action about the same thing, about why we came into healthcare, and to deliver that compassionate care. And they outline 4 steps that you can take in order for this to happen. And I guess we're seeing this coming through in many of those organisations. What's important to you? Engaging staff in that conversation, leading. This is a little bit blurred for me, so I can't see it on my small screen. But making that connection with staff and engaging them in a conversation, what's important to them, and then putting processes in place to make the change happen. And I guess, again, when I talk to the staff involved in this work, they tell me you can see there's a clear link between the leadership, the culture, the behaviour and the outcomes. And I suppose that's what I'm trying to line up in this presentation. And of course, the infamous Brian Dolan, who's been a huge advocate for this work about preventing deconditioning in hospital. And some of the things that Brian says, that if we change the narrative, make it have a different conversation about the last 1,000 days, what that means, what it means when we turn that on its head and when it becomes what's important to the patient, encourage us to think about doing things differently. And really, the time is the real currency of the health system, but it's the patient's time. It's not our time. We're visitors in the patient's life. And understanding why that time is so critical to them, especially in older years. And in his address that he made as president recently, and it was 2020, actually, he talked quite a bit. I know you won't be able to read that, but the point was that he'd made this address, that he talked about the future, and all of us are getting older. And why would we not think about delivering the best healthcare that we can now, because we're all going to be using it basically when we get older. And we know that the evidence is there, don't we, around the impact of hospital-acquired disability, the impact that it has on our ability to live independent lives, and the number of people who what happens when you have a fracture, what happens when you're in hospital, what happens if you stay for more than a month. And adults are 61 times more likely to develop a disability if they're in hospital for over a month. And yet, how many patients have delayed discharges? And what are we doing if we can't affect the delayed discharge? What do we do to ensure that they maintain their mobility and their independence while they're resident in hospital? So I think that Brian's helpfully offered to reframe it. And this for me is about, again, igniting the passion, changing the language and creating a new narrative from the old to the new, the old framing around falls prevention to safer mobility, from reduction of length of stay to giving patients back that critical time, from staying in hospital to days away from their home, and from history taking to storytelling and hospital in the home to there's no ward like home. And I really like that analogy that there's no ward like home. So I suppose, I guess, for today, in thinking about how we nationalize in the sense that every organisation is involved in this work, I think that we have to think about staff firstly, engaging staff in that conversation, being kind to each other, recognising where we've come from and where we're going to, and meeting each battle as they come, recognising that people are emotionally in a difficult place following COVID. We know we have workforce challenges, but I think there's no better time than there is now to re-engage a clinical conversation that draws in healthcare practitioners about why we want to do better and how we can enable that to happen. And I think that we have to bring the science to this, and there's so much evidence around deconditioning and what we can do to prevent it, and how easily it can be prevented by just taking a more innovative approach or a workaround to patients sitting in a chair or lying in a bed. The science is definitely there, and I think for me it sort of identifies, for nursing at least, that nursing is not just an art, it is an art and a science. It requires us to bring that evidence to our practice. Yes, it's important to have a person-centered framework. Yes, it's important to be there with the person, to be present, but it also requires us to bring the science and the evidence to get a better outcome for the patient. And so I just wanted to finish with this quote from Maya Angelou. I've learned that patients will forget what you said, people will forget what you did, but people will never forget how you made them feel. And I think that, you know, this initiative, this programme not only helps people to feel better, but they feel cared for, they feel respected, and they get a better outcome. Thanks for listening.
Charlotte, thank you so much. I'm sure everybody will agree that was really inspiring, and it touched me, and I'm sure it's touched many others. And just reflecting on what you said, I think it's especially powerful coming out of the back of the struggles that we've all had during COVID, how we can use something like reconditioning to galvanise our teams and to inspire people and to give them more satisfaction at work. And I think that's what we're going to hear from the James Paget team later. But just for me, thank you so much. I really appreciated that. Now, what we're going to do next is just take some questions from the floor specifically for Charlotte. So hands up, and we'll do it that way, I think. And if there's nothing for Charlotte right at this moment, what we can do is just go on to the James Paget talk. And then, oh, sorry, Amit, I didn't see your hand. Amit.
Thank you, Charlotte. That was absolutely brilliant. Such motivation and such inspiration. It's just absolutely amazing. So thank you for that. Charlotte, just looking at the work so far, how do we kind of embed this into the day-to-day practice, i.e. change of culture in the hospital, which isn't an easy thing. It might take ages to do that. But any pearls of wisdom will be really appreciated.
Mm-hmm. So I think you're right, Amit. I don't think it's easy. I think it's a huge challenge for people at the moment, and I think it's not something that you can turn around in a couple of weeks, as I'm sure my colleagues in James Paget's going to tell us. But we've got to start somewhere, and I think we can start small. We can start with our colleagues and our teams, and maybe just open up that conversation about what is important to us. Why are we here? What are we trying to do? What is our aim? And engage people in that conversation, and maybe create a set of values. You know, what is the value of this team? What are we trying to achieve? And how are our behaviours going to change to make sure that we can achieve our aim and meet the values? And when we start to change the behaviours, not suggesting people are disrespectful to each other, but more compassionate in our approach to each other, as we get a better result from team members, because we create that sense of bond, a sense of bond and valued and commitment and connection. And through that, I think in my own experience, that just, I mean, that can't be underestimated, because I think it ignites a passion in people. And now I think is the time for us to kind of regain that clinical ground across professions, to say, okay, right, we've had a horrendous time. We do have difficulties, but we will eventually get out of the workforce difficulties. But in the meantime, let's try and hold on to the staff we have. Let's make them feel valued, and let's retain their expertise and their skills. And just take it one by one change at a time, one patient, one day, a week, whatever, and build it up incrementally and slowly. But it's amazing the power of language and the power of values and behaviours.
Yeah, absolutely. Thank you.
Charlotte. Helen.
Yeah, thank you. Thanks, Charlotte. It's always lovely listening to you. I think it mine's more of a comment really around that opportunity that this sort of programme has shown, in that the ability to, as you say, bring people together from a staffing workforce perspective and do something that perhaps it's almost giving people the permission to do something a little bit different, try something that actually involves patients at the heart and the centre of everything that they want to do, but also engaging with families and other caregivers that actually have sometimes sought permission to do things with their relatives and loved ones when they're in a care setting, rather than actually giving us that response, giving them back that responsibility and autonomy themselves to do something a little bit different and ensure that their patient, their loved ones' mobility and activity is part of their care plan and ongoing day-to-day care, and it's not something that should be overlooked. So it's been really joyful for us in the programme to be able to look at the submissions that have come through and the activities and the innovation that's been going on up and down the country with regards to different groups of people doing different activities and really embedding sort of the joy that coming together to do something with meaningful purpose is really brought to everybody. So it's really great to hear your comments and your thoughts about what that feels like and where you're at with that. So thank you.
Helen, I might just respond to say that we're also developing a care partner policy, a national policy for care partners to be involved in care. And I suppose that's come on the back of COVID as well, where people felt that they couldn't visit and they couldn't be part of. And for people with specific long-term conditions or things like Parkinson's disease, where critical meds are really important, and even a half-an-hour delay on the administration of that medicine can have a huge impact on the person's ability to be independent. And many families have said to us, that they undergo a regime of exercise with people like that to try and maintain their mobility and level of independence. And when they go to hospital, that's stripped because the care team can't possibly be and do the same level of activity that an individual carer. And so when they didn't get access to the hospital, they felt really worried about the physical deterioration and the deconditioning that would happen. And I think we have to, if we go back to the person-centred framework, we have to think about individuals as people, as human beings who happen to have a medical condition, and their family are very much part of that care. And I get a sense that in some instances we've got used to owning the ground again in terms of particularly acute care and not having as many people in the wards. And I think we have to shift our mindset now to go back to a person-centred approach where our wards and departments are open for visiting, for people to come in and be partners in their care. It's a very clear message from the public.
Thank you, Charlotte. It's almost as if we moved our trusts and our organisations into command and control, and we also seem to have done that with families and their patients, that we are now in charge, and we need to take that step back with compassionate leadership at the heart of it, to just sort of rebuild where we want to be. Thank you again for that. And your speech your talk could have been retitled Compassionate Leadership, because that was at the heart of everything you said, and I really appreciate that message this morning. There'll be more time at the end for a few more questions for Charlotte. But next of all, we're going to move on to my delightful colleagues from James Paget University Hospital in Norfolk. So I'm absolutely delighted to be joined by Tracey Bitters, who's corporate lead nurse, and Joana Dias, who's corporate matron, and they're going to share with us their reconditioning journey from the Paget. Welcome, ladies.
Thank you. Good afternoon. No pressure. What an act to follow. I hope we we keep you as engaged. So thank you. Can you see my slides?
Perfect.
Perfect, thank you. So thank you for giving us the opportunity to come and share our story of reconditioning at the James Paget. For those that don't know, we are the most easterly point in the UK, in a, I would say, sunny seaside town of Galston, but it's not very sunny today, unfortunately, but we're very close to Great Yarmouth, an area of significant deprivation. We are a small trust, and I've just checked my quote because I do tend to get them muddled, but from small acorns grows mighty trees, so that's how we like to see ourselves. So our story, we had a significant wicked problem, and I was talking to Dr. Aurora before we started about when we did the deconditioning games. That was really difficult to get engagement, and it was really difficult waiting for somebody to take the reins and steer us on our way. And although we did okay during the deconditioning games, I actually felt a little disappointed that we could have done more and we could have showcased more of what we've done. So when the reconditioning games was launched, I was really excited, but also quite nervous that we would also kind of not do the same thing and not engage early. So I decided that I would take it into corporate and take the kind of rein and lead on the reconditioning games. And we're quite shy at selling success, and I really wanted us to showcase some of the really good work that we do at the Trust. We spent some time looking at what reconditioning was with all of our teams before we really started to launch into our reconditioning games ourselves. And obviously from the deconditioning games, recognising that I had allowed myself to be a single point of failure, and it was just myself submitting the medals. So we knew that we needed a different approach, and we needed to change the way that we did things here. But what was that approach? So we needed to be different than we were before. So we decided that we would use the corporate team to own reconditioning games. In corporate, we manage quality in the Trust, so we decided to pull reconditioning into our quality agenda, because recognising everything about reconditioning from staff and patients' perspective is about quality. We shared ownership. I've just started that. We shared ownership, so I brought my corporate colleagues into that so that it wasn't just one person and relying on one person to do the medals. And we started to share success. And actually what we saw was a little wave occur. So as soon as we started to tweet some medals, actually we had interest from other staff that wanted to know how to get a medal. And we started to get a little bit competitive as a trust. And we started a little bit of healthy competition with the other two trusts within Norfolk and Waveney, which was really good. And I see all three trusts are up there in the top of the leadership. So that healthy competition has worked. But obviously, whilst we're looking at competition, recognising it's all about the benefit of our patients and our staff ultimately. So it's okay to have a bit of healthy competition as long as the patients and staff are at the centre of what we're doing. Social media became a real selling thing for us, and we had to really learn to tweet because I'm a little bit older, so tweeting or twittering, whatever it is, was not something that came natural to me. So I had to give myself some lessons with my children on how to use social media a little better. And we started to really join some platforms and connect with people. And actually, what we recognised is, whilst I had started to do that, I wanted my team to start to do that as well, so they can create some links for their development as well. So hence my corporate matron took over the tweeting. She's a bit younger than me, and had great success. And then the epiphany happened, really. We found the solution, as I said. We brought this completely into quality. It really worked. We used myself and Jo, the corporate matron, as the leads for this. We started to share our story at every forum within the Trust that we could, and that included clinical leaders. We really engaged our chief exec, and we made our execs we requested that our execs do the first pledges, so that this came from the top down and that they were signed up to doing the reconditioning games and absolutely understood the benefit to our patients and staff. We made sure that we were visible and that we were talking reconditioning, and it became a part of everyday language and everything that we did. We had weekly communications out on Paget, so our internal. We made sure that we spent time with our communications team, selling some of the medals that we'd awarded, and getting more competition from surrounding wards and clinic areas. And we put we've got a quality intranet page that we've set up as corporate, and we put a special individual tab on there, reconditioning. So it's a one place to go for all things quality, and reconditioning has made that page. And then we had an initiative within our team about a quality trolley, and the quality trolley is bite-sized quality time. And what we did is we used that quality trolley to really get out across the trust and talk to our colleagues. We started with our acute wards, and then what we did is we, almost like a spider really, we spread our legs and went everywhere, to outpatients departments, to paediatric clinics, to maternity, across to our back office areas, because recognising that one of the comments we've received an awful lot is we don't always see the value of our back office staff, and we really wanted to understand what they were doing as well. So we literally, the poor trolley is now falling to bits, so we are going to have to buy a new one, because that trolley has probably travelled miles. We should have put a pedometer on that. And yes, we did it. We really did gain momentum. And I've had permission to say that we are one of the 2 trusts that on Tuesday received a Platinum Award, which we're really delighted that we received that, and that we're able to celebrate our success. So a big thank you for recognising the work that we've done. We became leaders, so Jo and I certainly really became leaders, and I think people they now understand what reconditioning is. I hope that every member of staff in our trust now really understands what reconditioning and deconditioning means to them and our patients. We have made a significant difference to our patients and to our staff, and actually to each other, with the pastoral support that we've offered, with the kind of getting to know our staff. We've engaged with other forums like our Patient Safety Incident Response Framework to really learn about what our patients have said, and learning from when we haven't got things quite right so we can make a change. We've really engaged different places like the Just Culture work that we've started to roll it out in the trust, about how we approach staff, how we do things different, listening to our staff surveys, you know, what do our staff feel they want? And what we found is a lot of the activities we were doing as a trust didn't always meet those staff that were on 12-hour shifts. So we were offering Pilates and yoga for staff, but actually if you were working till 8 o'clock at night, those classes had finished. So we fed back to those teams that we wanted something that was available to all staff, no matter where you worked, that you could go, and we didn't want it to feel that it was not available to those clinical staff. We also had weekly meetings as a corporate team, and we formed as part of our key performance indicator, looking at other nominations or other staff that came in. So we worked together to identify other quality projects or quality initiatives that were happening. So it became a part of our weekly key performance indicator meeting within our team. And the other thing that we did is we had staff coming to us for inspiration or for ideas. So some staff really wanted to make a difference, but weren't quite as blue sky thinking or wacky as us. So they came to us to ask, what can we do for our group of patients? And then we received some Innovation Cave money from our ICB, which was £400. Recognising that £400 didn't go as far as we wanted, we contacted our own charitable funds and asked for some money from our internal. And we were delighted that they actually gave us £1,000 to buy equipment for our patients. So we did a little wish list to all of our areas and asked what they wanted. And we're delighted to say that we've just started to receive in all of those things. So this work will continue for us, despite the fact that April the 31st is pending. For us, we will continue reconditioning, and that will remain a tab on our intranet page because we're really passionate about it. So we've now received some further pedals, some pedometers. We've received some washable Jenga. Everything's obviously able to be wiped down and shared amongst other patients. We've even received things like Rubik's cubes for manual dexterity and the snakes. And we've received bigger games like your bingo and your parachutes and other items that wards have come to us requesting. So we're in the process of slowly distributing them. I'll now pass on to my colleague.
Good afternoon, everyone. So I'll just come a bit closer. So I will now share some of our medals. So making a difference, supporting people to keep moving, and staff well-being. So on our first picture, we've got Dr. Aban. He's one of our consultants on Ward 12, which is care of the elderly. And one of the initiatives that Dr. Aban did was fundraising, so walking for the Alzheimer's Research UK. And initially, Dr. Aban was going to walk 28 miles, but he ended up doing 56 miles and raising £3,700, which is amazing. On our second picture, we've got our butterfly volunteers. So these are volunteers that spend a time with patients that are approaching end of life. So this can be the last days or hours. And what they do is they go and spend time on the wards, provide support, listening, even, holding someone's hand. So it's about compassionate care and showing empathy. Then we've had others for making a difference. So our second one was our emergency wedding box, which was by Tracey and Maxine Taylor. And this emergency wedding box was designed for patients that are approaching end of life and they would like to get married, celebrate, or do a blessing. And this wedding box is quite special because it's got different things. For example, wipeable flowers, decorations. And now this wedding box is kept with our site management team, so it can be accessed 24 hours a day if needed. Our second project was Mac's Legacy by Rachel Crane, and it's about a baby loss awareness project, and it's changing the environment in A&E. It's also about monthly peer support groups for patients that have lost their babies. The second one is our staff food bank, which can be accessed in the chapel, so for staff that are experiencing a financial crisis. And the last one was Clive Howard from the chaplaincy team, where he created a safe space for the chapel for prayer and reflection, which can be accessed any time of the day as well. And then our second category was supporting people to keep moving. So in our first picture, we've got the renal team and one of our patients. And this was using a pedal to support patients pedaling whilst doing dialysis. And we've had really good feedback from the patients. And one of the things they first ask when they arrive is, can we use the pedal? So again, it's about promoting independence. In our second picture, we've got Ward 12. So we've got some of our nursing staff and one of our physiotherapists. And what they'd use as one of their initiatives was to use the dumbbells with patients. And this was to improve patient strength, physical and mental well-being. And again, the feedback we had was really good. And then other medals we had, the first one was for our Global Tea Party. So the trust took part on our Nutrition Awareness Week. And one of the days was the Global Tea Party. And Ward 12, Care of the Elderly, Ward 4, General Medicine, and Ward 7, one of our escalation wards, took place. And what we did was, with the Global Tea Party, we delivered cakes and sandwiches around the wards. We sat patients out and we engaged with the patients and family. And again, this was really successful. Our second project was the Reader Project, which took place on Ward 6, which is trauma, and Ward 12, Care of the Elderly. And it was done with Ward 21 Reader Champions. And this was about using different activities, for example, bingo, jigsaws, singing. And again, what we saw was really engagement of the patients. And also we see a decrease in challenging behaviours as well. and we now continue to use Rita across the trust. On Ward 22, which is our orthopedic ward, one of the initiatives was the Joint School, where patients come in for elective orthopedic surgery, for example, hip knee replacements. And it's about educating patients what they expect on admission, during surgery, and on discharges. And it goes through, for example, exercises. And the aim is to prepare patients to go home and they are safe for a discharge as well. Then on our Ward 6, which is our trauma orthopedics ward, we got Out of Bed project, and this is where nursing staff, including healthcare assistants, mobilise patients when it's safely to do so, get the patients out of bed for lunch, breakfast, and dressed in their own clothes as well. We also got our from our dementia team, the Red Trolley, which is present on most wards, and with the Red Trolley, we've got different activities, for example, colouring, and different activities such as puzzles where we engage with the patients. And then our last one for supporting patients to keep moving is from our discharge lounge. So what we noticed was a lot of our patients were coming to the discharge lounge. They didn't have any clothes, so they were wearing pajamas. So we got new clothes for patients so they can get dressed and be ready for discharge. And then our last category was supporting staff to keep active and well. So during our Nutrition Awareness Week on a Tuesday was called Take a Break. And in the aubergine, we had information, so about physical, mental well-being. We also had fruit bowls, salads that staff could take. And again, we had really positive feedback. On our second picture, we've got our HCA facilitators, and they do a lot of pastoral support. So they go around the wards, make sure all HCAs are okay, if they need any support. But also what they did was they introduced Callback Day. So this is where they get all the HCAs together after a few weeks, and they have a debrief session. So what went well, what didn't go so well, and how we can improve next time. And it's about listening and communicating with each other. Other well-being was from Ward 21. So Ward 21, we're not a physical ward. We are known as the peripatetic team, which we work across wards A&E and intensive care. And what we did was a welcoming pack for new staff. And this welcoming pack has useful information about well-being, useful contact numbers, what to do if they need any support, and also information about each ward and each speciality and any learning that staff might want to do. And also what we do on Ward 21, our Band 7 and Band 6, is that we go around on a daily basis and we make sure that staff feel support, valued. We always ensure that they have a break, or if they have any concerns, to escalate to us. Also with our OD and wellbeing, so our free health checks, yoga classes, financial advice, the chaplaincy team, where they go and visit staffs on the wards as well, but also they go to back offices and include everyone. We've got our professional nursing advocates, where we deliver the restorative supervisions, and the trust has recently introduced our football sessions for any staff that want to take part. But also what we realise as well is one medal doesn't always fit each category. So for example, when we look at our quality trolley, so our corporate team will go with a quality trolley on a daily basis and deliver quality messages, which can include falls, pressure ulcers, medicines management. This is about supporting people to keep moving, because we are including quality of care and we're trying to reduce the number of pressure ulcers and falls. It's also about making a difference. And lastly is staff well-being, because we spend time with each member of staff, provide that one-to-one quality time and support, and allow staff to ask any questions. So finally, so what we found was it's not about winning with our reconditioning games, is about improving quality of care. And out of reconditioning games, we also have some quality improvement projects. So 2 wards have developed a transfer checklist between the wards. So this is ensuring that patients are transferred with belongings, all the correct documentation and the proper handover, for example, enhanced supervision levels. We also had a healthy competition. We improved patient flow. So one of the things that the discharge lounge is doing is when patients arrive on the discharge lounge from other wards, they work really close with the pharmacy, and they've developed a green tray. So when we take the medication from the discharge lounge to pharmacy with this green tray, the medication will be ready within an hour. So patients will get discharged a lot quicker. We boosted staff morale and a smile to everyone. We've done staff engagement. So a lot of people want to take part now, and they want to know when to win a gold medal award, what they need to do. We've improved patient experience and engagement, and we made a positive impact on patients, relatives, and staff. And most importantly, we think we've made a difference. So thank you for listening. Have you got any questions for me or Tracey?
Jo and Tracey, thank you ever so much for that. Absolutely fantastic. It's the ripple effect, isn't it? It starts with concentrating on physical deconditioning, and then it's completely holistic in terms of, you know, physical, psychological, spiritual, involving the chaplaincy team. We talk about it takes a village to raise a child, don't we? And I think what you've displayed there at James Paget is that it takes a community to bring this into its heart to fully enable reconditioning in the way that we want to. I've been at James Paget and seen their quality trolley. It's lovely. So thank you very much, ladies. And now we'll open it for questions, and these can either be for the James Paget team or for Charlotte. So over to you, hands up. Charlotte, thank you.
I just wanted to say a very big thank you to my colleagues for that. Was fantastic to hear about your journey, and I'm also struck by the fact that you started with something very focused, but actually developed and grew into a much bigger thing. And what struck me about it is the hook to engage people in a conversation about change and innovation, and the amazing support that you've given to staff as well. So I wanted to ask both of you, in your leadership journey, what were the key sort of strengths that you drew on to make this happen and be successful?
So I think we're really lucky here at the James Paget. There is an amazing culture here. It does feel like family. So when we start to grow, actually everybody wants to grow with you. And so for me, it's the people around me that has made this possible, and the fact that we do have supportive, you know, our chief nurse and deputy are really, really supportive of everything we've done. So and they're encouraging. I have to say, I think also the fact that I'm naturally very competitive does help. I smiled when Jo says it's not all about competition, because there is a little bit of competitiveness. Now we're at the top, we want to stay at the top. So yeah.
I would follow the same as Tracey. You know, we are very lucky within this trust as well, but I think it comes down to compassionate leadership. So I think I would describe myself and Tracey as compassionate leaders. So we listen to staff, we talk to them, and they know they can come to us if they need anything. So I think it comes down to a lot of compassionate leadership as well.
Thank you. You can definitely feel the compassion from you, ladies. Anybody else would like to ask a question to either Charlotte or the James Paget team? Just give it a wee second in case anybody's being shy. I think what I noticed as well, Tracey and Jo, was that you really had engagement from the executive. I remember the first time I went onto the executive corridors, they've all got the Recondition the Nation on their doors. Now, I don't know whether they put them up there or whether you did it for them, but it just had infiltrated every area of the trust. Did you find that those relationships with the executive empowered the rest of the staff to sort of let them feel empowered and free to continue with the work?
Yes, I do think so. I got described as a spider yesterday when I went on the corridor and smiled that the pledges were still up, and somebody said, Tracey, you're like a spider. I think the execs are more afraid of you than you are them. And I don't think that's the case, but they certainly have maintained their pledges. They've kept their pledges up. I do think that they've given trust for us. They've trusted in us to do the doing, but have definitely given us the support, and they are very engaged in that. And our senior nurse leadership team, I think it's really key that, you know, not just our nurse leadership, but our AHPs and our other colleagues that support deconditioning and reconditioning, or prevent deconditioning, support reconditioning, have all been engaged with us.
Absolutely. Thank you, Tracey. Any more questions from anybody? Do you know, isn't it amazing that deconditioning is something that's so harmful and so negative and so sad, and yet by turning it into reconditioning, this whole webinar has been filled with joy. Yeah. And it's really wonderful to see, especially going back to what Charlotte was saying, and the troubled times that we have been through and how people are feeling, to be able to do something that's positive for the patient and positive for the staff at the same time is truly remarkable and a real testament to the teams involved. So if anything else, Amit, have you anything else you would like to add before we wrap up for this afternoon?
No, I want to offer a huge thanks and congratulations to Tracey and Joe for the amazing work that they've done. And I've just put in the chat, Tracey, it would be really lovely to share those pictures of the exec corridor. That might be able to generate some interest in the other execs who may or may not be making this a priority. But what I did find was, I'll tell you what happened in my own organization where I work clinically. So it was one of the relatives of the quality matron who had deconditioned in the hospital. And then they then shared the story with the trust board in the trust board patient story section. And that generated a lot of conversation. And that generated a lot of interest, because if the chair and the chief exec are listening to what is happening to patients, then the rest of the organization cannot ignore it. So
absolutely,
that's quite powerful. Patient stories are absolutely powerful.
Absolutely.
So, but thank you, and thank you, Charlotte, as well. You've been absolutely amazing.
Tracey, did you want to come in there?
Yeah, I just want to say that I absolutely agree. We use a lot of patient stories and get permission from our patients or their relatives to use their picture when we present a story, because and we're actually going to start a project next week on see the person, not the patient, because I think quite often if a patient isn't able to share or have their own voice, it's really powerful. And I personally took that from the fact that my father had a stroke a few weeks ago and sadly passed away. But actually, for me, it was really powerful that you become, it's almost like you can't say who you are and what you are, and a picture tells 1,000 words or 1,000 stories. So we use patient stories an awful lot for our PSAF work that we're doing. They touch your hearts. They absolutely touch your hearts.
Thank you. Thank you very much, everybody. Well, thank you for everybody that managed to attend on the day before the bank holiday weekend. Thank you for listening, but most of all, thank you to Charlotte, Tracey and Joana for contributing today. Now, we have another one of these webinars, and I'm just going to check the date so I don't give you false information. I had written it down and I can't quite see it. I think it's the 19th of April. It's on the flyer. And the recording of this presentation will be available on the Future site, and we'll pop Charlotte and the JPUH slides up there as well. So I look forward to seeing you at the next